guys, welcome back to Medical Coding with Blue. Today's episode is all about, can clinical documentation integrity be performed without having medical coding experience or medical coding knowledge? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I will say this first and foremost. What I will say today will inevitably upset some people. But I say these things because, first of all, I am not selling a program. That is number one. I'm not selling a program. I do my recommendations, yes, but no one pays me to give my recommendations. So I am not selling anything. That's number one. Number two, I have seen a lot of people get into the industry and getting into CDI specifically that they are unprepared and they are ill-equipped to be able to handle such a position. So what I'm trying to express to you all today is the things that I am recommending in this video. They're of course my opinion, and of course it's going to be a little bit different from what the industry requires, because the industry does not require these things. However, there are things that anywhere you go, any profession you go into, whether you're a medical coder or a nurse or even doctors, right? There are nuances to the field that you will not learn from books, but you will learn in the real world, in the real world setting. Whether it is professionalism or whether it is something about a particular subject and maybe a deeper dive, or maybe it is just how to handle conflict or how to read body language. There's a lot of tips and tricks in each industry. This is a tip and trick, okay, for this industry when it comes to CDI. Because the industry does not require CDIs to have medical coding backgrounds or have medical coding certifications, I'm here to tell you that those that get into CDI without that knowledge, and while they may be working and they say, well, I'm working, I don't know what she's talking about, I guarantee you there's a lot of things that are being missed because that individual does not understand medical coding. Now, why is understanding medical coding so important to clinical documentation integrity? Well, let me explain what clinical documentation integrity even is in the first place. So CDI, clinical documentation integrity, is when you're looking at documentation and you are seeing that there are potential holes in this documentation as far as there's not enough detail or about a condition that the provider is treating, or perhaps there are clinical indicators and the provider did not document what these clinical indicators were about or what are they related to, and they're ordering something and it's not jiving with what is already documented. So with that said, people who have a clinical background like nurses are really good at spotting these things. They can look at these clinical indicators and see, okay, well, this lab says this lab says this, they ordered this, but what is the diagnosis to go with this? So that is their job, is to fill in those holes, to get that detail, to get that deeper dive into what the documentation is trying to say. This is not to pad the bottom line. It is not. What CDIs do is they're trying to get to the most specific code or the specific diagnosis code possible, because the doctor is not a medical coder. They are not trained in medical coding. They do not have any purpose in medical coding other than to treat the patient and give us quality documentation. But it is our job as medical coders to know and understand and to be able to apply all of those ICD-10-CM guidelines, the CPT guidelines, the E&M guidelines, all of these things. We have to be able to apply and know all these rules. The CDI has to be able to take it up a notch because they know the clinical indicators, they know where these holes are. And yes, while medical coders can know where those holes are after they've had some experience in that particular setting, they can spot things a little bit better than a brand new coder or a coder who is not as experienced in that particular clinic. They can spot things a little bit more. So you are not required to be a nurse in order to sit for one of the CDI credentials, and I'll talk about those here in a minute. You're not required to be a nurse. However, having experience in medical coding is a key to, if that's what you want to do, if you want to be a CDI, is to be able to have that experience. Now, for my nurses that are coming in and saying, well, I want to do CDI, and they have no idea about medical coding, Or their idea of medical coding is, oh, well, no, I did the coding for my doctor. Okay. And when I ask, what do you mean by you saying that you did the medical coding? Oh, well, we have a sheet that we have all of the usual diagnoses and the usual procedures, and I just check off those. That is not coding. Medical coding is when you are looking at documentation for an encounter, and you're saying, okay, well, or even an op note, okay? Don't get technical on me, guys. But you're looking at the documentation and you are able to abstract the diagnoses and the procedures and everything that's going on in there. You are applying critical thinking, and you are applying, of course, the guidelines to, mind your selections and mind the sequencing of your selections. So if you are not doing that as a nurse, what you're doing does not count as coding. You may think it does, and other people may tell you, oh yeah, that's coding. But if they are not coders, they don't truly understand that what they're telling you is wrong. So if that's been your only experience, my strong recommendation, again, this is not the recommendation of the industry, this is the recommendation of somebody who has no dog in the fight, whether you go into CDI or not. I have no dog in the fight. However, I do want to say that if you are wanting to pursue CDI and you do not know about medical coding, you need to start with the medical coding first, because it will make CDI make more sense. Because the other duties that the CDI has is to be able to educate providers, right? And hey, that's great, because providers and nurses already have a built-in relationship. When you have a nurse and you have a medical coder and they're both trying to talk to this doctor about CDI, the doctor is more inclined to listen to the nurse because they have this built-in relationship. Unless the medical coder has really put forth that effort and created that relationship and the provider knows them, then maybe there's a difference. But by natural sake, it's always going to be the doctor's going to go to the nurse, but that doesn't always have to be the case. Okay, so don't lose hope if you are just a medical coder and you say, well, I want to do CDI. There's plenty of very, very good medical coders that turn CDI, and they know exactly what they're doing. Okay, but it takes a lot of study. All right, but I will say this also. So when you are in this situation as a nurse, if you are a nurse wanting to pursue CDI, and you are trying to educate this provider, and hey, you're looking at this documentation, you see that this patient has the clinical indicators for X, Y, and Z, and the provider did not document it, and then you go back and you talk to the doctor and you say, well, there is a variety of things that I see here, that there's these clinical indicators, you ordered this test, but there's nothing documented for this. So this is a hole in this documentation, and we've got to get this sorted out. The doctor may not have even thought about saying, okay, this is the reason that I ordered this particular test, or I ordered this particular procedure to be done. Okay, they may not have thought about it. That's where the CDI comes in and catches them. But the CDI also has to talk to the provider and educate them on the principles of documentation. And again, it's not to pad the bottom line. It is so that we get the most concise diagnoses and the most specific diagnosis and procedure out of this documentation that happened to this patient. All right. And then on the other hand, the CDI has to be able to communicate with the coders and find out maybe some of their concerns with what is going on with the documentation. And maybe the CDI doesn't understand why the coder is asking these questions, because the coder knows the coding, but the CDI knows the nursing side. Okay, we need to marry these two. We need to marry them so that it makes sense to the CDI, so that the CDI is like, oh yeah, that's why they're asking that. Okay, let me go talk to the doctor about this. So that's why I'm saying it's going to make it easier for you to understand what you're doing as a CDI if you understand the coding. And again, let me say this very clearly. I will say this very clearly. If you are a nurse and you're disagreeing with me right now and saying, oh no, I do the CDI and I do the perfect job. Okay, here's the thing. You may think that you are, but if you have not looked into that coding, you don't know what you don't know. So my recommendation is, if you are so concerned with doing a really great job and making sure that that provider and those patients have really great documentation. So that in case something happens to that patient, that documentation can go anywhere with that patient, and the providers looking at that documentation will be clear on what happened to that patient. If that is the reason that you're getting into CDI, then you need to seriously look at medical coding. And you may think, well, that's just one more thing I have to do. Yes, it is. It is a professional responsibility that you now have if this is what you want to do. Okay? It would be like insisting that you want to be a nurse, but you don't want to learn about anatomy. Does that make sense to you? It doesn't, right? And it's the same thing with coding and CDI. You are missing a big part of the puzzle if you don't understand coding. A big part of the puzzle. So if you already have your CDI and you're saying, okay, well, I want to get better at being a CDI, I want to get better at my knowledge base, then learn the coding. And there's two major medical coding associations, the American Health Information Management Association and the American Academy of Professional Coders. Any one of these two, and you get a medical coding certification, that way you can start to understand what is really happening with the guidelines and why they apply. Because as part of being a good CDI is knowing those coding guidelines as well, but understanding why we have these guidelines is so important because of the diagnosis selection. And of course, when you're looking at procedures, CPT or ICD-10 PCS, then you're better able and well equipped to be able to perform your duties. It will not be as difficult if you understand the coding. And I've had some nurses, and y'all can admit this because we're all adults here. They have been very arrogant in saying, well, I don't have to know coding. Okay. If you don't have to know coding, then why are you talking to me then? You know, because again, I would want to set the person up for success. You can't go into CDI half-heartedly. And only focusing on CDI and not understanding the coding is going into it half-heartedly. And so if you take the time to go through a HEMA or AAPC and get a medical coding certification, then you're on your way to getting a better grasp of really what is happening, and then having even more knowledge to go with when it comes to CDI. And for my coders that want to turn CDI, there's a lot more that you have to do, right? You have to get into that clinical mindset, because even though you've never been to nursing school or you've never been to medical school, whatever, it doesn't mean that you can't pick it up. There's tons and tons of medical coders that have turned CDI, and they do a fantastic job because they understand what it means to understand the coding and to understand the CDI part. They know how to fill in those holes in the documentation as far as like, okay, well, we have a question here, there's a query here, there's more specificity that could be found here. All right. And again, it is not to pad the bottom line, but it is to get that most specific documentation out of that provider and out of that encounter that they had with that patient, because the details do matter. And if you don't understand the details do matter, just take a look at any of these data reports that come out. And then look at when we had the pandemic, right? And look at all those data reports that came out about the patients who had, what was going on. Think about that, guys. You have to be able to capture all of this information accurately. And the only way to do that is to know about the guidelines, know what it is to apply those guidelines. Because even for myself, I am currently a medical coder, and I code in an outpatient clinic. And even though I educate my providers and I'm constantly with them as far as like telling them about updates and things when they change and things like that, they look at me like I have three heads sometimes. They're like, I don't understand these rules, Blue. I said, that's why you have me, to understand the rules. So I'm just passing on this information. And as long as you document like I need you to, I'm not worried about whether or not the provider picks up the correct diagnosis, because I always go back in and I correct the diagnosis based on the documentation if they're not able to select the correct one. Because sometimes it may be just a thing with the electronic medical record that they're working with, that it may be difficult for them to sometimes select those correct codes. And sometimes with the computer-assisted coding, again, for those of you that get real excited about that computer-assisted coding, it's not all it's cracked up to be. Because remember, these programs are only as smart as the people that are creating them, right? And it doesn't have the ability to critical think. These systems do not have the ability to critical think. It will give you what is based on the algorithm, whatever it thinks it sees. So, for example, I have said this before, with this computer-assisted coding, it selected fall. Now, the documentation is reading to me that this is related to a time of year. The computer-assisted coding is looking for an injury. You see how this happens? So it's important for us to continue to use critical thinking when we are looking at this documentation and not rely heavily on things like computer-assisted coding, which again is only as smart as a person that is using it, and it will only pick up what it sees, right? What it is trained to see, and that's it. So it is up to us as human beings to use that critical thinking and to be able to correct and make sure that everything is in there appropriately, all right? So with that said, now what program do I recommend for CDI? Again, this is not an ad for CDI, for this program, but I will say that I have done this episode back in July, and I will leave the link for my YouTube video on this in the description box below. I don't know why people just don't go through the videos because this was done on July 11th. It aired how to become a CDI for medical coders or nurses. And I literally said in the title, the best school for CDI, which is HC Pro. They do have a 60-day CDI boot camp. Now, I underwent this boot camp myself, and this is an excellent program. It is modeled after ACTIS, the Association for Clinical Documentation Integrity Specialists. It is modeled after them. They were the ones that were hands-on with the creation of this program, and it is an excellent program. It is pricey, and you only have 60 days to complete it. No, you cannot get an extension. No, there's not a longer program. That is why it is called a boot camp. All right. And so that is the one that I recommend because I personally have gone through it myself. I've seen the quality of the materials that are presented, and I like the interactive quizzes that they have on there, because they have quizzes and things like that. So that if that is something that you are interested in, I'm telling y'all now, please do not ask me, because I will leave the link in the description box. You guys have to learn to do your research. When I'm getting easy questions, simple questions like what program do you recommend, what this, what that, and my channel is filled with them, I don't answer anymore, guys, because that means you're not doing your research. And if you want to be in CDI, if you want to be in medical coding, that is the number one thing that we do, because people will not give you this information all the time, like handing it out to you, when, especially when I've already done it myself. You know, I've done quite a few CDI ones. But that's just what I would say about that. So HC Pro, and again, I will leave that link in the description box below. I will leave the video also in the description box below. I recommend their program for that. I also recommend their study guide just to kind of help you to study. It doesn't necessarily mean that that study guide is going to be exactly everything that is on the test. You do have to use critical thinking and know that these are the domains and this is what you got to know. And you have to study, okay? That's the ins and outs of it. If you do not have a medical coding certification and you are interested in getting a medical coding certification so that you can, because you heard my words and you understand what I'm trying to say, then you want to go with the American Health Information Management Association, the CCS, that is the gold standard of medical coding credentials. I say that because it covers inpatient and outpatient coding. This says you have mastered inpatient and outpatient coding, all right? Then there's the CCA, the Certified Coding Associate. This says that you have the entry-level competence to code for inpatient or outpatient, okay? And then they have the CCSP. The CCSP is a Certified Coding Specialist, physician-based. That is all outpatient coding. And again, if you are in the outpatient setting, that's the one you want to get. But if you're going to be on the inpatient side, then you are going to want to look at the CCS, really, especially if you have a nursing background, or a CCA. Okay, that would be the idea of what I would think first, right? Because I think with ACTIS you need the CCS. Okay, I don't think they do CCA with that one unless you have an RN. Then you'll be okay to take that test with an RN. Okay, just saying. But you got to look at the website. And then there's also AAPC, the American Academy of Professional Coders. They do have their flagship credential, the CPC. That's all you need. Unless you want to do inpatient and you want to take it with the test with AAPC, then that is also the CIC, Certified Inpatient Coder. You do not need the plethora of other credentials that they have because all of those are rolled into the CPC, right? Their flagship credentials. So if you're interested in going with AAPC, just know that they do require you to be a member every single year. If you do not pay your membership dues, they will revoke your credential. It is $205 every single year. It is 36 continuing education units for one credential. So I will say that. Now, AHIMA does not require you to be a member, but they will charge you a separate fee. It is not as much as the $205 every year that AAPC charges, but they do charge you for reporting your CEUs if you are not a member, which is just their administrative fee, you know. So that is the ins and outs of the two. Now, I will be doing an episode about which one is which as far as like with the credentials, because I believe there's some confusion going on with which credential should I get? Which one is better? Should I get the CCSP or should I get the CCS? And is the CCSP better than the regular CCS? Okay, now hold on. That tells me that there's a little bit of confusion about what these credentials mean and what they are and what they're for. So I will be doing that on a whole completely different episode. But my strong recommendation for you all that are nurses is that if you are wanting to get into CDI, please do not let your ego get in the way thinking that you don't need to know medical coding, because you're just setting yourself up to fail. You need to know medical coding because that's a very large component of what a CDI is all about, although they do not do coding, okay? It's just something that you need to know. Again, it's just what I said before, the analogy about you're wanting to be a nurse, but you're not good at anatomy. Does that make sense to you? That doesn't make sense, right? It's the same thing, and that's the only way that I can put it, because that's how I would think. You know, if you don't have a strong anatomy or medical terminology background, it's going to handicap your ability, again, to be able to do this. So it's the same thing with coding and CDI. You need to know coding. Coding is a very, very big component, even though it is not required by the industry. Why that is, I don't know. I don't know, but what I know of the industry and what I know of these positions, it is a really good thing if you do have a background in coding. Okay, so get your certification, or get some knowledge. Get in a study group if you're looking at a study group. If you want to create a study group of your own. I also have my Patreon channel. We have our once a month live study group on Patreon, which will be this week. It'll be on the 20th. It'll be on a Wednesday this month. It'll be on Wednesday. So all of my patrons that are in the $10 and up pledge amounts, they are all invited to that. So if you join before Wednesday, well, you get to come too. So, but anyway, I'm going to go ahead and wrap this one up, guys. But like I said, this is not meant to insult anybody or, you know, make you think that, oh, you need these are things that would set you up for success. Knowing the coding, that sets you up for success. And again, I've given my recommendations, so I will leave everything else, my contact information and everything, in the description box below. All right, so with that said, I'm gonna wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.